Hi, welcome back to Kid Focus Dentistry YouTube channel. Today we are going to talk about what to expect for the infant tongue tie and lip tie release. Go ahead and come into our office and you're going to fill out some papers. The most important one is the one that pertains to all the symptoms that you have. And this is important for me because at our office I only release per functional problem. So even though, let's say we take a lip tie, so a lot of kids will have lip tie, but some kids that is enough to cause some problem, but that's not happens to every kid. So once I review the information that you guys have given me, that will help me determine more of what kind of problem you have. After that, what we do is we'll do an exam on your child. I will basically fill in all the sites that where there is some kind of ties on there, and in conjunction with all the problem that you currently have, we will come up with a diagnosis. I understand that young mother, you guys are overwhelmed and usually it's very difficult to get out of the house because it just takes so long. So I usually always try to offer, if all possible, the same day treatment for mothers. So if this is something you are interested in, I tend to find that sometimes when you go to the consultation, you don't expect the treatment to be offered at that same day. So if you are wanting to do same day treatment, make sure you bring that support person with you, because again, this is not a hard procedure. However, it's always nice to have someone with you to give you that mental support. And of course, we will always address any kind of questions that you have at that time. If you want to know more about what usual symptoms of different kind of ties, we will leave the link below and you can watch on that. So the process usually takes about 10 days for the infant to fully heal. However, the first 3 days, 70% of the soft tissues will be healed by that time. What I tend to find is really going to correlate to the discomfort of your infant. It's not so much a severe amount of pain because their pain receptor at this time is not the same as your pain receptor. However, infants are extremely good at letting you know when something that they don't like. So just think of when they have a wet diaper, how much do they cry just having a wet diaper. So you will expect some kind of expression of discomfort for your child. So what most mom will tell me is about first 3 days, sometimes it can carry up to around 5 days that they might not take to the boob as easily. So I always recommend to go ahead and make sure you do have a bottle just in case they don't want to take onto your boob, because it does require a little bit more effort on there to supplement feed. However, I always recommend to you to go ahead always to introduce the boob first, especially with a lot of infants who usually come to me about already a month or 2 months old. They already establish a compensating pattern of feeding. So even though I released the ties, it doesn't mean the infant's going to know right away. It is a process of unlearn the old habit and learn a new habit. So it's going to take that introduction to the boob for them to learn to overcome that. Sometimes if they don't want to take a lot of your milk, then you can go ahead and right after that you can supplement with the bottle. But I always recommend to go ahead and introduce the boob at every single time of feeding. If your child is a little bit older, the older they are, the more they are really good at expressing their discomfort. Or if they're really old, like 6 months and up, I definitely think there is more nerve innervations going into the site. You can go ahead and give your child some Tylenol. Just be aware that it takes about half an hour for the medication to kick in. So make sure you don't wait until your child is extremely uncomfortable before giving the medications. Especially right after the procedures, you can go ahead and give your child some medications, some Tylenol on there, and that will help with everything, to help you with the transitions on there. Right after the procedures, what I'm going to do is I'm actually going to hand the baby back to you, and I will have you breastfeed the child. Does it matter whether you breastfeed your child before or after? Not really, but I still prefer your child not to be super hungry because then the PreOp procedure is going to be a little bit harder because he or she is already uncomfortable. So go ahead and feed your child a little bit more, probably maybe half an hour before you see me. That will make the transition a little bit better because then after I do the procedure, you can go ahead and try to feed your child again, and by that time they would want to take you onto your boob a little bit more. It also, during this time, what it does is allow me to kind of help with the diagnosis a little bit more. I will look at the pattern of how you are feeding your infant, because breastfeeding is just not about the thighs only. It does correlate with your anatomy, it will correlate with his anatomy. Sometimes that's what that has to do with is sometimes the palate or the jaw size. Sometimes the jaw size is so far back that maybe just moving it up a little bit more will help with the breastfeeding. And after the feeding, I'm just going to go ahead and sit with you really quick and show you how to use the coconut oil to kind of help facilitate the healing and the stretches that you're going to do for at least the next 10 days. Keep in mind that the first 3 days is extremely important. It's really difficult, especially for first-time mom, to want to do anything that makes your child uncomfortable. But this will determine the success rate of your release. So even though you are putting the coconut oil on, your child might be a little bit uncomfortable. But again, once you remove that discomfort, your child should be feeling just fine. So I recommend the coconut oil to be put on right before the breastfeeding. What that does do is, yes, you make your child a little uncomfortable, but now you start feeding your child, and so that will go into that comfort level and kind of help soothe your child a little bit better. And then after that, what we're gonna do is we're going to make an appointment for you to see me again in 2 weeks. In between then, I still highly recommend for you to still see your nurse practitioner because she has seen this a lot more. She's a lot more experienced at seeing how other mothers and other kids are reacting after the procedure of tongue-tie release or any kind of laser release. And she can give you a lot of times some advice, better advice than I can, because she sees so much more infant per day. So hopefully everything will feel really good. You start feeling the changes on there. Sometimes, the older the kids that are coming to me, the harder it is for them to relearn the correct breastfeeding. So just be really patient with that. And usually by 2 weeks, you're gonna start seeing some of the positive changes. When you come in, I will give you another paper very similar to the first paper. It's basically kind of tell me about the condition, how you are feeling at that time, and will allow me to kind of see what else do you need. We usually always encourage you to continue to see your nurse practitioner, but we can pinpoint like, hey, maybe there's something more going on. We'll also look into to see whether you need body works for your child or not. And I was also check your child physically in the site to see how the area is healing. At this point, if your child have a tongue-tie release, I will go into furthermore of different exercises for the tongue. Usually by this time, all the ties on the top lips area, we don't need to do additional exercise. They heal pretty well, pretty easy on there. They don't have a lot of fibers to kind of make it reattach. However, because the tongue is on the floor of the mouth most of the time, we want to get additional stretch. So the outer surface at this time is fully healed. However, the fiber underneath is still healing. So it's constantly contracting. So the exercises that we're gonna show you is gonna help continue to stretch that on there. We also gonna introduce to you guys some kind of games that you guys can play with your kids. Again, this is to really help get the most out of your release. 50% of the release, the infant will need some kind of re-release down the line. What we're trying to do with these exercises is actually minimize that chance for you, and hopefully down the line, your child does not need any more re-release. So I hope that is helpful. Again, if you guys have any questions, you can always give me a call or check out our website. We do have a lot of information on there.